Hi, my name is Alexandra, and today I'm going to be inserting a catheter, Foley catheter with the female. Here I have my gloves, I have a towel, 2 towels, and the kit that I will be using, as well as the trash and my hand sanitizer. Okay, so let's begin. So we're gonna knock on the door, closed door, closed curtain, hand hygiene. Hi, my name is Alexandra. I'm gonna be your nurse today. Can I please have your name and date of birth, please? Look at wristband. Thank you so much, Mrs. Barza. So today we are going to be inserting a Foley catheter into you, doctor's orders. He noticed that you were having difficulty urinating, so we're going to go ahead and put that in. Is that okay with you? Okay, great. Do you have any other questions for me as of now? Okay, great. So I'm going to start by putting on my gloves. So let's put this on. And then we're going to put this glove on. And we're going to take some soap and water, and we're just going to clean the area and dab it off. I'm going to explain that to her. Okay, Mrs. Barza, so today we're going to be cleaning the area with soap and water before the sterile procedure. Is that okay with you? Okay, great. So I'm going to start by opening it up, and then I'm going to take my towel with soap and water, and I'm going to start from the furthest side from front to back. Okay, so we're going to go front to back. We're going to take another part just so we're not cleaning the area with a dirty surface, and we're going to start on my side, front to back. Okay, and then we're going to go down the middle, front to back. Okay, we're going to dispose that. Now instead of drying, we're going to dab. Okay, from front to back, from the furthest side. So front to back, different area, front to back on my side, closest to me, and then we're going to go down the middle, front to back. Dispose. Okay, I'm now going to palpate the area and inspect just to make sure that nothing is red, swollen, or anything unusual. I know that everyone's looks different, so everything looks good. Okay, Mrs. Barza, so we're going to take off our gloves now. Okay, and then we're going to do hand hygiene. We usually would wash our hands, but for the sake of the video, we're just going to sanitize. Okay, I'm going to get everything ready, Mrs. Barza, for the sterile procedure, just so that way it's easy sailing for you. Is that okay for you? Okay, great. So I'm first going to start by taking out my thing, and I'm going to use this plastic bag as a trash as well. Okay. Now, I'm going to then open this up with the 1-inch margins. Okay, like that. And then I'm going to just turn this. Okay, now I'm going to be using the gloves to put them on. Okay, we're going to open this. Okay, and then we're going to take the 1-inch margins and open that up. Okay, I'm then going to get my glove and put my hand in there. That. Taking my 4 fingers, getting my hand in there. Okay, I'm now going to grab this from the middle and put this in the trash. Okay, now since I am sterile, I can move this. Okay, so I'm going to put this right there. I'm then going to take this bib, and there's a shiny side on it. I'm going to put the bib under the patient. So I'm going to tell the patient to lift her butt up. So Mrs. Barza, can you please lift your butt up? And we're going to pretend that the bib is underneath her butt. Okay. And then we're going to get this bib, and we're going to put this around the patient's vagina, and we're not going to try to touch the patient at all. And this is ripped due to practice purposes, okay? And we're gonna set everything up. So here I have my alcohol swabs and my lube. So I'm gonna put the lubricant and put it right here. Throw this away. Take out my 3 alcohol swab sticks. Throw this away. And then I'm going to put my catheter, and I'm going to kind of take it out a little bit, right? And I'm going to insert the, I'm going to take this off and insert this into the lubricant that I have right here that I put, and we're going to throw this away. Okay, now this is where everything begins. Okay, so first we're gonna start by putting the 10 cc's of saline water, sterling water, and we're gonna plug that into the green area right here. Okay. Now, everything is good. I'm gonna be using my left hand to keep the lid open, and we're going to begin. Okay, so I'm gonna take a cotton swab, and I'm gonna start from the furthest side, front to back. Okay, so front to back, dispose. Okay, I'm gonna take another cotton swab and do the side nearest to me, front to back, dispose, and the last one is gonna go down the middle. Okay, dispose. Your hand does not leave that area. Okay. Now we're gonna take the catheter from the loop and we're gonna stick it into the patient. Okay, Mrs. Barza, so I'm gonna start inserting the catheter into you. Is that okay? Okay, great. So I'm gonna take a little bit of it, kind of like in my hand, and I'm going to stick the catheter in by pushing it. Okay. Okay, around 2 to 3 inches. Okay, now I'm going to push around 2 more inches just to ensure that it's in there and the balloon is passed. And then I'm going to hold the catheter in place on my left hand. Okay, just so that if the patient coughs or sneezes, it doesn't come out and move. I'm then going to take my 10 milliliters of water and I'm going to push that through the catheter, holding that. Okay, and then I'm going to let that go. Okay, and for me to take off this sterile water, I have to use both hands, and I'm just going to unplunge like that and dispose it. Okay, because if I take it off without having that assistance, the water will come out. Okay. Okay, so how are you feeling, Mrs. Sparks? Is everything okay? Okay, great. Let me go ahead and take all this stuff off. Okay, so I'm going to take off the drape from the patient. And I'm going to dispose that. I'm then going to take this, take out the catheter bag. I'm going to put this to the side for now. Okay, and then I'm going to throw all this away since I still have my gloves on, right? And I'm going to throw this away. Okay, how are you feeling, Mrs. Bars? Is everything okay? Okay, great. Are you in any pain? No pain? Okay, good. So I'm gonna place this below the urine, right? And I'm gonna put it not on the bed rail, but on the bed frame, kind of like hang it on the bed frame. So we're just gonna imagine we put that there. And then I'm going to educate the patient about what she should do. So, okay, so since you're not in any pain, please make sure that if you move from side to side that you have some availability of that this goes with you, so that way it's not pulling on you. And then if you have any hurt or you're in any pain, please call us and let us know, and we'll come over. And lastly, if you need to get up, again, please call us and we will assist you. Okay? Does everything feel okay for you? Okay, great. So I'm now going to take off my gloves and I'm going to throw them away. And then I usually am going to wash my hands, but for the sake of the video, hand hygiene. And then I'm going to chart everything in the system to let them know and the future nurses know who are coming onto the my shift. Next, that we did put the catheter in when we put the catheter in, and just keep up on how much she urinates within the catheter. And yeah, thank you so much.